Hi everyone, my name's Dan Hayes and I'm here with my colleague Emily Stapley, and we're very pleased to announce that we're one of the recipients of the Emerging Minds Network bid for our project to look at developing social prescribing to improve mental health for children and young people. Next slide please. So before we go into the project, I just wanted to outline our team a bit more. So first we've got Emily Stapley, who is based at the Evidence-Based Practice Unit, which is part of University College London and Freud Centre, along with myself, also based at the Evidence-Based Practice Unit, and we'll be co-leading this project together. And then we've got three other members of our team. One is Dr Marcello Bertotti. He's based at University of East London and has a background in social prescribing and health inequalities. And then we've got Paul Jarvis Beasley, and he is part of the Street Games Network, and both Paul and Marcello together have set up the Youth Social Prescribing Network. And then we've got Professor Jessica Dayton, who's also part of the Evidence-Based Practice Unit, who will be giving some strategic oversight to the project. It bears worth mentioning now, although we haven't set this up, that we'll also be setting up an expert reference group to guide the project. This will consist of 2 young people, 2 link workers and 2 clinicians. Next slide, please, Em. So to give you a bit of background on what social prescribing is, there's not really a fixed definition of social prescribing per se. One of the most dominant models is the kind of link worker model, whereby a GP or other health professional refers onto a link worker, and then the link worker explores with the patient ways to explore what types of activities they'd like to participate in. To date, the majority of the literature has been targeted in adult populations. So a recent systematic review by Bikerdijk found that actually there's evidence to show that when you engage adults with that have mental health difficulties or want to improve their well-being in social prescribing, it helps. And this is thought to be largely underpinned by a kind of biopsychosocial approach to health inequalities and mental health and well-being. Predominantly, this has been targeted in older adults in particular, such as those with kind of dementia or those suffering from loneliness. NHS England and Public Health England have outlined that social prescribing is set to increase further, so they're going to be rolling out 1,000 extra link workers by 2021, and within that there is a need to target or focus on children and young people as well. Currently, there are young people that can be part of social prescribing and be involved in social prescribing, but we conducted a recent review and found that the evidence was patchy. So we found evidence around the country where it's happening, but not really any evidence base, both within the grey literature, such as kind of internal reports, but also in the wider literature. So currently, we don't know how social prescribing works with children and young people and if it's effective in terms of the evidence base. Next slide, please. So following on from the review, which, as I've outlined, highlighted that there's a lack of evidence to date to robustly say how or if social prescribing can help children and young people, the review made 2 concrete recommendations. The first was to understand the best referral routes for social prescribing for children and young people. Is the link worker model or the kind of public health model where you GP prescribes to a link worker and then onto a service the best model, or would we want to look at other routes, such as whether a teacher or faith healer or directly a young person could refer into social prescribing? And that second aim was to understand the current barriers and facilitators to social prescribing with children and young people. We know it can be happening, but anecdotally and from kind of how patchy it is around the country, there may be barriers which are inhibiting it at the moment. So as part of the bid, we'll be working with Emerging Minds and our collaborators to answer these 2 questions.
So to understand the best referral routes for children and young people to access social prescribing, so our first aim, because we don't know much about this to date, so there's been very little research on it and very little exploration conducted so far. to work out what children and young people think of this and how they've ended up accessing social prescribing and what might be the best ways for them to do this. We're proposing to take a qualitative approach in our methodology, so really taking a bottom-up look from young people's experiences on their thoughts on social prescribing and what's been happening from their perspective in relation to that. So we're going to, at the moment, conduct 3 focus groups with around 5 to 6 young people in each group. And one focus group is going to explore young people's experiences of more traditional referral routes to social prescribing, so such as through your GP. Another is going to explore non-traditional routes, so that may be through a school or a worker in a school setting. And then we want to do another focus group just to have a discussion generally on the different models of referral routes that might be possible and which ones appeal to young people. To address our second aim, which is to understand the barriers and facilitators to social prescribing for young people, we want to do one-to-one interviews with different groups of stakeholders. So this might be young people, link workers, GPs and clinicians. And we want to get a sense from their perspective about what works and what perhaps works less well in relation to social prescribing for young people. And in our approach, we're going to draw on the theoretical domains framework, which will allow us to build up an account of the factors that can influence social prescribing. And it aims to capture individuals and services' capability, opportunity, and motivation in the factors that we identify through our qualitative work. So the analysis methods that at the moment we're proposing to use are firstly a framework analysis approach to data management to be able to facilitate exploration of similarities and differences between different stakeholders and groups of participants' views. And then we also want to use a thematic analysis approach to enable us to look at patterns or shared experiences and themes across participants' accounts of their experiences of social prescribing.
So in terms of the outputs that we are looking to achieve from this project, there will be 2 academic papers, one related to each of the questions we've just previously outlined. We also, along with our expert reference group, are going to produce a blog and vlog of the findings for children and young people, as well as a report which can be distributed through the Youth Social Prescribing Network, outlining our findings. We'll also present at the YSPCN conference, and a seminar will take place at the Anna Freud National Centre for Children and Families. What we hope to achieve going forward with the wider aims of this work is that once we've understood kind of the barriers and facilitators, to then work with services using the behaviour change wheel to implement social prescribing within select few services, and then from this build up the evidence base to understand how and if social prescribing can improve mental health and wellbeing with children and young people. Thank you.